introduction. I see we're going to be recording this.
Yeah.
And I'm going to share my screen just so you all can see my presentation. But first, I'll say my name is Deborah Gerson. I'm a pathologist working at Catholic Medical Center in Manchester, New Hampshire. And in case you don't already know what pathologists do, most people, if they know anything about pathologists, they think that I'm a forensic pathologist, and it's just like being in CSI all the time, crime scene investigation. But in fact, that's not what the vast majority of pathologists do. We're involved with managing the laboratory and looking at samples taken from patients, like tissue biopsies or blood samples, to make a diagnosis and help their doctors to be able to figure out the best way to care for them. So now I'm going to share my screen. Here we go. So you should be able to see my slides now. Please let me know if you don't for any reason. So I have lived in New Hampshire for about 3.5 years. I was just telling Jeff, and I've just recently become involved with this new organization, New Hampshire Healthcare Workers for Climate Action. And we are a grassroots, nonpartisan group of all different types of healthcare workers from all over New Hampshire. So we're welcoming to anyone who has any association with healthcare: doctors, nurses, social workers, people that work in the nutrition department in the hospital. We even have a few veterinarians in the group. And we're also interested in sharing our message with the public with the goal to eventually, hopefully, get some meaningful climate action happening to increase the health of all the people of New Hampshire and the whole world. So let's see. The first time that I really thought about the link between climate change and human health was during my residency training in Miami. And you can see on the left here, we have a picture of my daughter, Rachel, on the day before Hurricane Wilma hit in October of 2005. And you can see that already we have some breezes kicking up, and she's looking out to the horizon, wondering what's going to happen next. And in the lower right corner, you can see my husband, who is trying to clean up our garden after the hurricane, because there were so many trees down. And at the end of that hurricane, in all of Miami-Dade County, there were only 16 working traffic lights left. So imagine how many traffic lights there must be in Miami-Dade County, and now there were 16 left that were working. And almost everybody in the entire town lost power. And a lot of people didn't get it back for 2 or even more weeks. We were without power for 10 days. It was very hot. You can imagine in Miami, even in October, it's very hot. We didn't have a refrigerator to use to cool down my daughter's milk because there was no electricity. And people started to have some health problems related to this. So they could be directly injured by the hurricane, or they could have trouble getting to a doctor's appointment because of all the traffic problems and trees down in the roads. Some people had problems getting their medications at the drugstore that they needed. And some people who lived in Miami and didn't know what we all know up here in New Hampshire, which is that you cannot run your generator in the house, right? So people in Florida had never had to run a generator before, and they all decided that they would go out to the store and buy one and run it inside their house, so there was carbon monoxide poisoning. So that year was a terrible year for hurricanes. We had 3 big ones right in a row between October and August: Wilma, Katrina, and Rita. You'll recognize some of those names. And scientists believe that the severity of hurricanes is worsening with climate change. They're able to predict that we wouldn't have such severe hurricanes. We might have the same number of hurricanes, but the overall severity of these hurricanes is increasing because of warmer water in the oceans due to climate change. So this picture just shows my kids and my dogs, because I just like to show them to everyone. But really, I put them here so that you could see why I'm doing this. And I'm basically here talking to you about this because I want to make sure that we have a healthy, beautiful place for my kids to live when they grow up, and hopefully someday have grandkids. And these are all pictures taken in different places in New Hampshire. And I had to throw in the extra dog because he was new and he wasn't in any of the pictures with the kids. And now, because this is a talk for a library, I thought I would throw in my favorite climate change books. I don't know if you've read any of these yet, but this book by Bill Gates, How to Avoid a Climate Disaster, I like this one because it is very, very serious and breaks down all the solutions and exactly what we have to do in usual Bill Gates fashion. He just goes right to the point. Here's what we have to do, and here's how we should do it. And then I like the book on the right, the Drawdown book, because it's kind of your coffee table book of climate solutions. So if you can page through it, and it has, I don't know, 100 different possible solutions to climate change. Not that we would only choose one, we're going to need to choose many of them, but a lot of them are very interesting and you wouldn't think of them, and I think it's fun to look through. And then the one in the middle is a cli-fi science fiction about the climate novel called The Ministry for the Future. And I really enjoyed this book because I think it's very hopeful about what the future could hold and what we have to do, but it was fun to read and I liked it a lot. So I'll just recommend those. And then now on to what we're going to talk about today. So we're going to go through very briefly the science of climate change, because I think most people are fairly familiar with that now. Then we'll talk about the impact of climate on health, and especially these impacts that are important in New Hampshire. And then we'll talk about possible solutions and suggested actions. And then we'll have time at the end for questions and discussion. And I would love to hear what you all think about this topic and whether you have any stories or suggestions or ideas about what we can do. Okay, so to jump right in, the science of climate change. What is climate change? So it's a change in the average conditions like temperature or rainfall in a region over a long period of time. Weather is something we experience over a short period of time, like what's the weather like today, but climate change is when climate changes over a long period of time. And as you can see in this graph here, NASA scientists have observed that the Earth's surface is warming, and many of the warmest years on record have happened in the last 20 years. So most people are aware of this now, but the greenhouse effect, basically what happens, the sun sends out light to the Earth. Some of it is reflected back. Some of it is radiated as heat inside of our atmosphere, and our atmosphere acts like a big greenhouse and keeps the heat in. And because we've been burning so many fossil fuels when we drive our cars and power our factories, we're changing the composition of our natural greenhouse. So we've made it better at staying warm. This graph shows that these are ice core measurements that scientists have taken of how much CO2 is in the atmosphere at various dates. So you can see that for millennia, atmospheric carbon dioxide has never been above this line for the last 800,000 years. But then here, somewhere around here, we hit the Industrial Revolution and we started burning fossil fuels, and it goes way up. Here's the level at 1950, and then the current level is 420 parts per million, which is the highest level in 800,000 years. The United Nations established a group called the Intergovernmental Panel on Climate Change, and they were established in 1988, and they've made 5 different reports so far, and the latest report was in August of 2021. And the main takeaway points that they said were, first of all, that this is unequivocally the vast majority of global warming that we're experiencing is due to human activity. Number 2, we've already warmed 1.1 degrees Celsius on average, which is 2 degrees Fahrenheit, since the mid-1800s. And they expect that even if we stopped right now producing any greenhouse gases, we would get to 1.5 degrees Celsius, which is right here, within the next 2 decades. And this 1.5 degrees Celsius was the original goal of the Paris Agreement, that we would try to stay below this number. And the upper goal was set at 2 degrees Celsius. And many scientists really feel that we would be much better off and save ourselves from some of the worst impacts of climate change if we can stay closer to this 1.5 degrees Celsius. And if you look down below here, basically the future depends on us. If we make substantial cuts in our emissions, we can stay down here in this nice happy range. And if we make no cuts, we're going to go up here and have a lot of serious problems. Now, the good news is nobody actually thinks we're going to end up at the high end here. It also will be pretty hard for us to be down here at the lowest end. So probably we're going to end up somewhere in the middle. And my hope is that we're going to come as close to this low end as possible. And that's why I'm here talking with you all about it today. And just so you know, some areas are warming faster than other areas. And New England is actually warming faster than a lot of areas. And we're already at 1.5 degrees Celsius of temperature rise. Okay, so how does it affect climate change and health? Or how does climate change affect our health? This editorial here is from the New England Journal of Medicine, which is possibly the most respected medical journal in the US. And on September 5th last year, they published this editorial, and it was simultaneously published in over 200 other health journals around the world. And this article describes how human health is being seriously harmed by global temperature rises due to climate change, and that we must do something about it. The WHO has also declared that the health effects of climate change are the #1 health problem in the world, surpassing COVID and other disease states. And as far as how much is this costing us, the NRDC did a study, and they found that the cost of climate-related health problems in the US right now is $800 billion a year. And for comparison, the cost of cardiovascular disease was calculated at 300 billion. So this is a big problem for our health, and also a financial problem. Okay, so this diagram here from the CDC talks about how different impacts of climate change, so increasing CO2, rising temperatures, more extreme weather, and rising sea levels, causes these different exposures, these different areas that people are going to be exposed to, like extreme heat, severe weather, air pollution, changes in vector ecology, all of these different exposures. And then out here, we see what disease processes these can lead to in people. So for example, we can just go right here, and I'll give you an example here. Rising CO2 levels and rising heat are increasing allergens, like pollen, for example. So if you can imagine, if we have more days where it's warmer, we're going to have more days that we can have seasonal allergies because the season is longer. And additionally, it's been found that carbon dioxide, when we have a higher level of carbon dioxide in the atmosphere, plants actually produce more pollen. So you can see how that could lead to increased allergies and a worsening allergy season for people. I'm not going to go through all of these because it's too many for our talk. We're just going to focus in on a couple of ones that are, I think, helpful for New Hampshire. So you can see in this map that depending on where you live, you may be more or less impacted by various health impacts. So, we all know that if we live out in the Southwest, we need to worry about wildfires. But we haven't had any wildfires or a serious problem so far with wildfires in New England. Sometimes we've smelled the smoke from their wildfires as it wafts across the country, but that's not one of our main concerns. So what we have here is extreme weather events, high temperatures, tick-borne and vector-borne diseases, mental health impacts, and air quality. So I'll just talk about a couple of those. So first we'll talk about extreme temperatures. A heat index is actually a number that factors in relative humidity and tells you how hot does it feel on a given day, given the temperature and the humidity. So if it's really humid out, you feel hotter. So that's what the heat index is. So what you can see in this graph, and this data is from Concord, New Hampshire, and you can see that in the last 40 years, we have had, on average, 7 more days where we feel that we have a heat index of over 90 degrees. And that number is expected based on projections to be above 20 in the next decade. And when it's above 90-degree heat index, it's not so safe to be outside. So how does this extreme heat impact our health? It can come in several different levels. So we can have mild symptoms like rash and heat fatigue. We can have heat exhaustion, where we're sweating a lot, very thirsty. We may have a rapid heart rate. We can feel nauseous. And then if we keep getting hotter, we can end up in this area of heat stroke, where your core temperature is over 103 or 104 degrees Fahrenheit. At this point, you can't sweat anymore. So your skin may be dry or only just a little moist. And you can have confusion or fainting or even go into a coma. So this is very severe heat stroke. And at that point, there's a risk of mortality. In the US, 700 deaths a year can be attributed to extreme heat, 67,000 visits to the emergency room, and 10,000 hospitalizations. And worldwide, 350,000 deaths per year are attributed to extreme heat. So who's at most risk for these effects of heat injury? Well, first of all, inner city populations are at especially high risk, and this is because they live somewhere where there's a lot of asphalt and not a lot of green space. So as you can see in this diagram here, downtown inner city can be as much as 10 degrees higher than the suburbs. So it can be a lot hotter there, so people are at risk. And a lot of times people that live in the inner city may not have air conditioning. And this is an example of something that we call climate justice in the climate movement. And this is where people who have done the least to cause climate change, they've done not so much burning of fossil fuels themselves. They're not jet setting around the world in private jets. They're, not running an air conditioner because they don't own one. And they may be suffering more than those of us that have been more lucky in this world. So also high school and college athletes, anyone who has to be outside in the extreme heat is at risk. I know my kids have both done cross-country running in the high schools here in Bedford, New Hampshire, and they're out there when it's 95 degrees. And I'm always worried about them. And every year there are a few deaths among young athletes in the US caused by these hot days. And then also different types of agricultural workers, that people are different types of workers who have to be outside. So agricultural workers, construction workers, landscapers, these types of workers can be very at risk for heat injury. In fact, OSHA has come out with a bunch of recommendations about how to keep outdoor workers safe in extreme heat days. And then just one more thing about extreme heat. There are other risk factors for who's likely to be impacted by the heat. The elderly are the highest risk group, partially because they may have comorbidities like heart disease or lung disease. And also there are some medications that can make you more likely to get dehydrated or cause kidney injury that older people tend to be on. But also others, very young children, patients who are pregnant can be at a higher risk. Then the next topic, climate change and mosquito and tick-borne infections. So vector-borne diseases are infections that are transmitted by arthropods like mosquitoes, ticks, and fleas. And we have many different examples of these. One of the things that pathologists do in the hospital is we review peripheral blood smears. And so this is a blood smear. This is actually taken from the CDC website, but I see a number of these every summer. And what you see here are the red blood cells, and inside of them, there are these ring-shaped parasites. And these are an organism called Babesia microti. When they line up with 4 of these little ring-shaped guys in a cross shape like that, we know that it's this organism Babesia, and it causes a disease called babesiosis. And some people, when they get infected with Babesia, they are totally asymptomatic. And some people have flu symptoms, just like the flu. And then rarely it can be a severe life-threatening disease. So it doesn't sound so bad, but we do also have to worry that when somebody has babesiosis, they have a high risk of having another tick-borne disease also. So if a patient comes in with babesiosis, they will immediately check to make sure they don't have Lyme disease or anaplasmosis or another tick-borne infection. And you can see here on this graph, this is preliminary data from the New Hampshire Department of Health and Human Services, and it just shows that anaplasmosis and babesiosis, two tick-borne diseases, have been going up significantly even in the last 20 years. And here's a picture of the black-leg tick that's responsible for transmitting these different infections. And then one more graph about this. Lyme disease, these are the number of cases. Each dot represents one case that was reported to the CDC in 1996, and then over here on 2018. And you can see that there are a lot more cases in 2018, and also that they're spreading. And so where you can see in 1996, there weren't that many cases in New Hampshire, and they were more, well, I don't know, there weren't that many cases, but now there are a lot of cases and they're spreading northward. And my kids, my teenagers were very smart to point out here that Massachusetts seems to have no Lyme disease in 2018. That is actually just a change in the reporting standards that year. There was not actually no Lyme disease in Massachusetts that year. So how does climate change increase vector-borne diseases? What you can see here is maybe something that you've noticed if you're a gardener. I've been doing some vegetable gardening, and I look in the almanac and it says that I can put out my tomato plants on Memorial Day weekend, and I'm realizing I could put them out a few weeks earlier, and that we're not going to have a frost. So what you can see here is that in the last 50 years, we have on average 34 more days without a frost in New Hampshire. And so during these times where it's above freezing, the ticks can be out and biting us and transmitting their tick-borne diseases. So just because of this, we're more susceptible. And another person in my climate change group actually got a tick bite in February in New Hampshire on one of those days when it was 64 degrees. So it's pretty easy to see how this could increase the amount of Lyme disease. Okay, and we'll talk about one more area, extreme weather events. So I didn't think moving from Florida to New Hampshire that I would have to worry about extreme weather events, but we're not expecting to have big hurricanes hitting right on the shore of New Hampshire, but we are expecting to have increasing heavy rainfalls, floods, and storms and storm surge. And we'll talk about how these can directly cause some medical problems, but also floods and storms can disrupt critical public healthcare and related systems like hospitals. They can be impacted by these things. So that can cause its own health problems. So because the water is warming and the atmosphere is warmer, more water can actually evaporate into the atmosphere. And so what this is doing is it's everywhere in the country, it's increasing heavy downpours. So even where we have droughts in the Southwest, the number of heavy downpours in a single event with a lot of rain is increasing. And you can see in New England, we're especially impacted by this. So this means that we're going to have more floods. And in addition to that, we have a lot of coastline in New Hampshire. We have not just the coast, the sea coast, but we also have rivers and things like that. And we have had more flooding in the US due to both astronomical tides, just high tides, and also caused by storms, or both of these, because sea level is rising as well. So how does this impact our health? There's some obvious ways. You could be in an accident or have a traumatic injury in a flood, but also in the history of New England development, a lot of industry and commerce was built along rivers and canals. And these areas have a higher density of contaminated sites like old factories, waste management facilities, things like that. And if they flood, those toxins can get into our water supply. And additionally, if someone's septic tank floods or sewage treatment floods, those contaminants can get into our water and cause viral and bacterial contamination. And also there's an increased risk of mental health problems following a severe weather event. So for example, if your house floods, there's going to be some mental health impacts associated with that. Also, you can imagine that if this was your house right here, when the water goes down, you're going to have a high likelihood of growing some mold in your house, which is not good for your health as well. Okay, so that was a lot of doom and gloom. I apologize. I wish that part was shorter. Maybe I should make it shorter. But is there hope, and can we fix this? Okay, so I really believe that there's help. I wouldn't be bothering with this if I didn't. I have a lot of faith in human ingenuity, and I think we can do it. So what do we have to do? There are two parts to the solution. One is mitigation, and this is the part where we stop producing all these emissions and we start stabilizing the levels of these in our atmosphere. So that's crucial, obviously. And then the other part is called adaptation, and that's where we adapt to the climate change that we're already experiencing to make sure that we are here, for many generations in the future to enjoy when it gets better because of mitigation. So we need to do both of these things. I apologize for one of my 3 dogs is barking. So what about mitigation? This is the part that gets me really excited. We already have a lot of the solutions that we need available to us. So for example, wind could supply the electricity we need 40 times over worldwide. So this is a great resource. And are we using it? In the US, which some people consider to be behind on the front for wind energy, even in the US, in the year 2000, we produced 6 billion kilowatt hours of electricity from wind. But in 2020, that number went up to 338 billion. So that, I don't know what increase that is, but it's huge. From 6 to 338 billion is big. And according to Environment America, who has looked into how much we could get from offshore wind, we could get 7,200 terawatt hours per year if we started really going at it with offshore wind. And that's almost twice the amount of electricity we consumed as a whole country in 2019. So wind is a great option. Solar energy, there's enough solar energy reaching the earth every hour to fill the world's energy needs for a full year. And so are we taking advantage of it? In 2002, we thought the solar energy market would grow 1 gigawatt by the year 2010. We exceeded that by 17 times. By 2019, it was exceeded by 121 times. So solar market is going crazy. Solar cells have gotten much cheaper. Look how much cheaper they are. In fact, I just got some on my house last year, and it's great. And what about storing wind and solar energy? We need to have batteries to be able to store that, because at night there's no sun, and when the wind is not blowing, we can't use wind energy. So batteries have gone up a lot, and you can see that it's increased quite a bit since the beginning of battery storage, and this is the projected rise of storage capacity. And also, a lot of people might think that if we try to switch to wind and solar, it's going to be really expensive and we won't be able to afford to do it. But actually, wind and solar are some of the cheapest forms of electricity that we have now. And I don't mean to sound like wind and solar are the only options. These are just ones that I find interesting. We have these auto manufacturers here are all moving to make electric vehicles, and that we can use our clean electricity to run them. Oops, I need to go to the next slide, not look at that one again. This is a website called Project Drawdown. And I'm just showing to you, it's actually related to the book I mentioned. And they have all these different categories of climate solutions listed by sector. And if you click on one of them, for example, electricity, it brings up all kinds of different possible solutions that you can look at. And some of them sound really weird, like landfill methane capture. And this is just one of like 5 pages of things that are on their website. So there are so many possible solutions. And I thought I would throw this in here just because there are a bunch of crazy sounding solutions people have come up with. Painting mountains white to reflect more of the sun. They're actually doing that. I'm not sure if I condone that or not, but it's interesting that somebody thought of it. Here in Wales, there is a new company that is taking diapers and paving roads with them. And their company is called Nappy Cycle, which I thought was pretty cute. And asphalt is actually a large carbon sink. We have a major problem with how much carbon is produced when we make asphalt. So this is a great solution. And then here is my favorite one. Here we're using submarines to refreeze the poles. And I don't know that we'll do all of these things. This hasn't been put into action yet. And they even were talking about maybe they would have a way for tourists to be able to go aboard these submarines. And then this is something that's actually already happening at the Detroit Zoo and in many other zoos around the world. They're making electricity from animal manure to run the zoo. Okay, so just 2 more slides. We're almost done. In New Hampshire, transportation is the majority of our greenhouse gas emissions. You can see 47%. Also, we use a lot at our homes. And this slide just shows that the New England states have made different commitments to renewable energy. And you can see that New Hampshire, unfortunately, is way behind our other neighboring states in having a goal to go carbon neutral. That's something I'm hoping that our organization can work on getting changed. Oh, I forgot about these. Real quick, adaptation. We have a program that the CDC has helped to organize that is called the BRACE framework, which allows our health officials in New Hampshire to come up with solutions to protect us from the health impacts of climate change. And this diagram here just shows different projects they're already working on in New Hampshire. So they've got several programs working on tick safe training. They have ones for heat stress and the elderly, heat stress in urban areas, severe weather resilience. So we are doing something already in New Hampshire about this adaptation. And now the last section, last slide, what can you do? So I think the most important thing is to make your voice about this heard if you believe that we need to do something about climate change. You can call, write, or email your elected officials and tell them that you want them to do something about climate change. You can vote for people who believe in doing something about climate change. If you want to, you can join a climate group. You can come to our website and watch some of the informational webinars that we have going on. You can talk with your friends about climate change. Unfortunately, climate change has become a very taboo topic. And people, although there's getting to be a lot more agreement that it's real and that it's happening and that it's caused by us, people aren't talking about it because it's a taboo topic. And there also are personal lifestyle choices that you can make as well. And I have a list of those if anyone would like me to share them. But I want to make sure we have time for questions. So I'm going to stop there. And please, if you have any questions, I'd love to answer them if I know the answer. And I would love to hear what you all think about this. So for now, I'll stop the share. Does anyone have any questions or comments? Liz? Oh, Liz and Kathy, you're both muted.
Okay, I'll unmute. This was great. It was really a nice connection between 2 important topics, people's health and the health of the earth. I heard you say that you have some veterinarians in your group, and I wondered if you have been doing a lot of studies about the impacts on animals and sea animals in particular. I mean, is that something that that health issue, something that you focus on? Or
so I don't personally, and we've just started making some contacts with veterinarians, and I'm not sure. I know one of them is working on ticks in the moose population. But I don't know of anyone specifically working on sea life, but I do know it is that climate change is significantly impacting sea life. One of the projects that New Hampshire is working on is about testing oysters off the seacoast to make sure that they don't have Vibrio cholera, which is a bacteria, or Vibrio vulnificus, which is a bacteria you can get from eating oysters, and it increases with warmer water. So Yeah, so there are serious impacts, but I can't add much about that. Kathy, were you going to ask a question?
Given the current circumstances with wars, how do they impact? They can't be good for the climate based on all that we even see, the bombings and the fires and things like that. I don't know how you can counteract that, but I'm sure it contributes quite a bit and to the health crisis that goes with it.
Well, certainly it's been really upsetting seeing what's been going on in Ukraine the last few weeks. Um, I don't know what the exact impact of the fires and things that are going on in these different wars are. I definitely agree with you. It probably isn't helping. My guess is that overall, the impact of that is small compared to everything else that we're doing as humans and all of us driving our cars every day, billions of us all around the world. But certainly, war is not a good thing for human health overall. And I've even seen some suggestions, and I'm not suggesting there's enough evidence on this, but that warming temperatures are increasing tensions between people. I don't know if that's true or not. I'm not
Well,
sure
if it leads to shortages on food and the water situation um, that is affected by climate.
Well, that's absolutely true. And there's quite a lot already of so-called climate migration, which is where people are moving from areas that are not as habitable anymore due to climate change, or not as able to produce enough food for their families. So that is another thing that's already happening.
Thank you for the presentation. I
Oh,
did want to say, the book you commented, Drawdown, I really like that book to show my kids. It's very fascinating. In the top 10 like most impactful things that can be done, and one of them is a plant-based diet and also reducing food waste. And I think those are things that I try to impart to my kids. Like these are things we could do, and composting and those kind of things. Even though we do on a small level, I know places like Hannaford, they have eliminated all food waste.
oh, wow.
I
I
saw it in
didn't
the
know
paper
that.
like a year ago where they have contracted with some farm. Anyways, no waste of food. And so I think that's an amazing thing. And I know a lot of people here in Etna and Hanover and around do the composting that's
Mhm.
picked up. But I think I encourage everyone to look at that book. It's a really interesting book.
I think that was a great comment. I love the book too. I'm also going to share with you in the chat two different links. The top one is a survey if you would like to fill out and let me know whether you thought this was effective or not, and if you have any suggestions. And if you want us to keep in touch with you, you can put your email in. And then the second one is a link to a list of personal actions that someone within our group came up with. If there are things that you would like to do, if you'd like to know what things you can personally do. And composting is definitely on the list. And I actually listened to a podcast episode yesterday about composting. And not only is it saving food from going to the landfill, but apparently the way that it composts in the landfill in an anaerobic way releases worse greenhouse gases than if you compost it in your backyard or at one of these commercial composting facilities. So yeah, I agree. And eating a plant-based diet or a more plant-based diet is definitely one of the top ways that you can impact climate change. It's kind of tricky in my house because my husband is a carnivore. Um, but what I try to do is I'm a little sneaky and I sneak in a couple of meals per week that are plant-based. And I also try to make each meal have a little bit less meat in it. So it might be a pasta dish with some meat in it instead of a big piece of meat. Um, what are other ideas does anyone else have anything to share?
I'm I'm trying, I guess with the pandemic and being home a lot more, I don't go to the grocery as often, and so therefore I'm really trying to better use of the foods that I already have. Um, I
That's
noticed
awesome.
that was a good habit to start.
Yeah, I agree. It looks like Betsy U is asking about with electric cars, where are the batteries recycled? Betsy, I wish I knew the answer to that question. I do not know the answer to that question, where the batteries are being recycled, but I do know that what they're doing with these batteries is of prime importance for also for environmental reasons. And I know that they're working on that problem, but it's not an area of expertise for me. Sorry.
Deborah, I was wondering if there's other climate action groups that your group works with, either healthcare related or non, to help spread the word to other
Yeah,
geographic areas?
we are making an enormous number of connections with different climate organizations and also with different healthcare organizations within the state. And they're all on our website. Now I can't think of any off the top of my head, but we're with the Nature Conservancy is working with us. We're actually making a video project with them. We're League of Conservation Voters is doing some work with us. We've reached out to a number of different organizations throughout the state. The New Hampshire Medical Society is one of our partners. We have quite a few different groups that are working with us. And I would encourage people to get involved in whatever, if you're interested in getting involved in climate action, think about what you are good at or what you know how to do or what you're most interested in doing, and try to apply that. That's what I did trying to get involved in climate action. At first I didn't think of getting involved in climate change from a healthcare perspective, but while thinking about what would be a good way for me to get involved, I realized I didn't know that much about how to recycle car batteries or how to make electricity, but I do know about healthcare. That's something I do know about. So that's why I've gotten involved in this way. And there are a lot of different ways you can get involved.
Yeah, that's great. It does seem, when you first think about it, like such a big problem that individuals have no control over it. But it was really encouraging to see how broad that list was of options that we can do that can help.
Yeah, I agree. And even if you just do a few things on that list, you're making a great start, and talk to your friends about them. Someone told me yesterday the factor that most influenced whether somebody got solar panels on their roof was seeing solar panels on their neighbor's roof. So I'm not saying everybody has to go and get solar panels, but if you start taking your compost to the composting facility, I'm sure there's one up there. Well, I'm not sure, but I'm guessing there is somewhere near you, or composting in the backyard, and you tell your friends about it, soon there will be a green revolution happening and everyone will be following suit. So that's what I think about that.
Does anyone else have any comments or
Well, I
questions?
just have one comment. My sister in Arizona is doing her small part by trying to buy products that don't have plastic packaging. So she has pills that are toothpaste that she gets in a cardboard box.
Oh, wow.
Instead of deodorant, she has a stone that you wet it and put it on, and that's that. She has sheets of something that go in the washing machine instead of detergent. And she has a couple of other things, but she has sought out these unpackaged products, and it's kind of cool.
Yeah, that's awesome. I mean, plastics are actually, not only are they made out of fossil fuels, they're made out of oil, but producing them uses a huge amount of energy. And they're also very, as everyone knows, very polluting. They end up in our water and they end up in the ocean, and they're not good. So I think that's great. It is kind of hard though. I don't know if anyone else has been on this quest like me, but I've tried at the grocery store to buy less things in plastic containers. So when possible, instead of getting a bag of potatoes, I put the potatoes right into my own reusable shopping bag. But let's say you want to buy strawberries. At my grocery store, there is no way to buy strawberries without getting a piece of plastic. So I've been thinking about going up to the service counter and making a suggestion, but maybe I'll do that this week.
The farmers markets will have them soon.
That's a very good point.
I don't know. At one point, I ordered Hello Fresh. You know, those meals. They were good and it was fun, but there was so much packaging. You know, every little thing was packaged. I just couldn't. And the same, I have eye drops that need to be refrigerated, and the mail order pharmacy would send a big box, a styrofoam box, and these other things in the styrofoam box to keep the right temperature till I got it. As opposed to, which I don't do that anymore, I go to CVS. They give it to me, I take it home and put it in the refrigerator.
Yeah.
They're this little and it comes in this big box. It was frightening.
Yeah, I feel the same way about it. Sometimes I'm just very unhappy when I get my mail and find that I've ordered something that has come with so much plastic packaging. Or now I've noticed that all these different mail carriers have started delivering packages, and if it's raining, instead of walking up to my front porch and putting it there, they take an enormous clear plastic bag and put it in there, and then they leave it in my driveway. Instead of the 10 extra steps of walking to put it under an overhang. And I can't throw those out, so I'm keeping them. I don't know what I'm going to do with them, but
You
I've
can
got a
put
bunch.
your used clothing that you want to take. I use big bags that I get for that.
You could take
I
it on
think
vacation, yeah, and use it for your laundry pile too.
I think it's good just to be able to be creative, and it might be fun if you have little kids what ideas do they have? And then they could start thinking about that when they're little.
I think that's a great idea.
Deborah, based on just going off that, does your website have kind of tips for talking to kids about this, or any like activities for kids directly to engage?
Well, we don't yet. We do have a children's health working group. And I know that they are working on those sorts of things. We've only been an organization for about 8 months now. So we're still working on getting our programming together. But I will suggest that to the Children's Health Working Group. And I know there are books that are directed to kids about climate change because we don't want to give them such a doom and gloom picture that there's nothing we can do about this. It's a lot for us to process hearing about all of this. And I think as an adult, hopefully we can see the hope there. But with kids, you get a little bit nervous about scaring them, especially in the world the way it is right now with the pandemic and so many other things going on to be worried about.
I would think that children's books would be hopeful and more of a fun kind of, what can we do to help this? And also, if you list a few children's books with your adult books, that might be helpful for parents.
That's a great idea. Yeah, my kids are teenagers.
Yeah.
But I could definitely find out what good books are, or I could get Jeff to do it for me.
Yes,
Yeah, because I have a
my
grandson.
librarian hat on and then do some research. Yeah,
That's right. Let me know.
I will.
I'll check them out at my local library and then add them to my list.
Me too, Jeff.
Okay.
I have a grandson, so. Well, this was great. Thank you so
Thank you.
much.
Yeah, thank you so much, Deborah. Any other last minute questions or comments?
If there's any follow-ups, maybe you could put them in your newsletter or email them to
Definitely.
the people that came,
Sure.
if there's anything new.
Yeah, well, and please check out our website. And I don't know if you were able to see in the chat where I put the personal actions link and the survey, or I don't know if Jeff can share those
Yeah,
somehow.
I can share that through email too, and get that out there.
Okay, great. And do visit our website. And we have a webinar there's an area called Our Events on the website, and we have all of these webinars by different experts from around the country that know far more about this topic than I do, in all kinds of different areas. And anyone is welcome to attend for free and listen to the webinar. And I think it was who was it who mentioned the plant-based diet? Is she still here?
That was Lisa. I think she had to
Oh,
sign
yeah.
off.
Okay, well, we have a webinar coming up in a few weeks that is by a Harvard professor talking about how we can feed the world sustainably and healthily. And I'm really looking forward to that one. I'm hoping he has some recipes for my husband too.
Yeah, I've seen some statistics about plant-based diet and how much food we use feeding livestock and everything. It's incredible the difference eating more plants would make.
Yeah, well, and also it's interesting what if you're eating meats, which meats you're eating makes a difference. So chicken, for example, not someone here from the beef industry is probably listening, but it's much better to eat chicken than it is to eat beef, or pork is better than chicken. So if you're going to eat meat, eat less beef and more chicken. And honestly, that's better for our health as well. This is a co-benefit of eating less meat and eating less red meat, is that it's also in its own right good for our health. Actually, a lot of the climate solutions can be looked at in that light as well. So walking instead of driving your car is better for your health and better for the planet, unless it's over a 90-degree heat index.
And you can do those kind of things in increments, like slowly think differently about your meals and shopping.
Yeah, I agree. And I'm not suggesting that I'm perfect about any of these things. We're all a work in progress on this.
Thank you so much. Thanks,
You're
Jeff.
welcome.
Yeah, absolutely. Thank you, Deborah. I really appreciate it. That was great. Thanks for everyone who watched tonight and participated, and have a great rest of the day. Great night.
Thank you.
Bye.
Bye.
Bye.